Greetings. I am Dr. Narasimhaiah Srinivasaiah. I am a colorectal surgeon at Apollo Hospital Bangalore. Irritable bowel syndrome. What is this? Every patient, or at least every second patient with vague abdominal symptoms is labeled as irritable bowel syndrome. What is it, by the way? A syndrome is a constellation of symptoms which is caused by absence of any organic pathology in the bowel and a functional component exists. Irritable bowel syndrome is not because of an infection, not because of an inflammation. There is no organic pathology within the bowel, but the patient is troubled by symptoms. This can be associated with the state of mind, and this is what is called as irritable bowel syndrome. Patients who are anxious, patients who are type A personalities can be troubled by irritable bowel syndromes. Stress is a significant factor. Within the spectrum of irritable bowel syndrome, there is IBS constipation, where people struggle more with hard stools and difficulty evacuating, and irritable bowel syndrome D, which is diarrhea, where people are struggling more with loose stools. Associated with these is bloating, discomfort, vague abdominal pains, and associated anxiety. We tend to see about 2 to 5% of the patients with disorders of the mind having irritable bowel syndrome. To diagnose an irritable bowel syndrome, you need a good, thorough history, a good clinical examination, rule out any pathologies with the pelvic floor, rule out any slow transit constipation or thyroid problems, rule out inflammation in the bowel, thereby confirming that there is no organic pathology. One of the most important investigations to have is a colonoscopy and biopsies before we label somebody as irritable bowel syndrome. It could be to do with bowel dysbiosis. Because of too many antibiotics we are taking, we have destroyed, or we would have destroyed, the balance between the good and the bad bacteria, and that can cause symptoms. We need to rule that out. And also take care of the diet, because some patients are troubled with dietary changes, and we prescribe them what is called as FODMAP diet. So ladies and gentlemen, irritable bowel syndrome is a common problem. It is unfortunately extensively diagnosed wrongly. It needs to be looked at, history taken, examined, evaluated, and then you confirm whether it is truly an irritable bowel syndrome. Following this, treat them with different modalities, and that should solve the problem. Thank you one and all.